Hey, this is Renee here at Men's Health. I wanted to tell y'all about a patient that I worked with over the course of a year that did so well, and so many of her symptoms completely went away. When she presented, she was in her late 40s, wasn't sure when she went through menopause because she had had a hysterectomy for severe endometriosis, had a lot of brain fog, fatigue, low mood, anxiety, poor sleep, racing heart, and severe constipation. And the worst thing for her was her migraines, where she was getting at least 2 severe migraines a week, despite seeing a neurologist and being on prescription migraine injectable medications. She also needed numerous prescription medications to help with managing her constipation. So when she came in while we were waiting to get her first set of labs back, I recommended that she try removing the top food sensitivities, gluten, dairy, eggs, and soy, just to see how she felt. And also because of the IBS constipation, we suggested she minimize high FODMAP foods initially until we could get her gut in better order. So with her first lab review, we uncovered that she had significant impaired glucose tolerance, where her blood sugars were getting really high on the 2-hour glucose test, and also she was starting to get some early insulin resistance. We also found some low minerals and vitamins, and that her sex hormones were well within the menopausal range. So we talked about the importance of treating premature menopause because there can be long-term consequences for bone and cardiovascular disease, and for cognitive function if menopause is premature and not treated. She wasn't ready to start hormone replacement therapy just because of all the stigma that we've all heard about and concerns of breast health. So we delayed that for a while and worked on gut issues with the IBS and treating some of the micronutrients that we found. So with just the basic elimination diet, she did feel a boost in her energy, not much of a change in the headaches, but brain fog and energy did feel better. So close to the 3-month mark, she decided she was interested in trying some bioidentical hormones that we just send through your regular insurance plan to your regular pharmacy. And she had gone through some of the gut repair work, looking at herbals that help with constipation, and we even used a prescription antibiotic to help with SIBO. So between that and starting the hormones, at the 4-month mark, she reported that her energy was tremendously better. Her weight was down over these course of these first few months by over 10 pounds, and sleep was better, and her headaches were virtually non-existent, she said. So a few months past that, things were still going well. She had lost a few more pounds. She was overall just still feeling better and better. Exercise was becoming more of a routine, and her bowels were moving easier, and she was needing less medications for helping with her bowels. She also decided to stop her prescription migraine medication because her headaches were feeling so much better. We did, by the year mark, repeat initial questionnaire that we had done for her medical symptoms, which put into a score. And initially her medical symptom score was 117, and at the year mark she was in the low 30s. At this point, she reported to me that her energy was good. She was happy with her energy. Headaches were still non-existent. Sleep was good. She was just very happy with how she was feeling and very grateful for all that she had learned through working with me at Men's Health. I hope you find this talk to be helpful, and if there are things that are bothering you with your health that you want to try to get resolution with or improve, come see us at Mint and we will help you get started.